In this article, in this article, we're going to look at what drug-induced psychosis is, when it's more likely to occur, and how to support someone. How can you tell if someone is experiencing a drug-induced psychosis? We are reading a topic about drugs and alcohol from Drug and Alcohol website. I hope this will help you. Drug-induced psychosis can look like a person who speaks in a confusing way, such as very quickly or without making sense. They act odd or might be unpredictable, hostile, or aggressive. They have an unusual emotional responses, such as showing very little emotion or having trouble expressing feelings. They appear lethargic or unmotivated. They withdraw from others. They seem fearful, suspicious, or anxious when there's no obvious reason for it. Drug-induced psychosis is when someone experiences a psychotic episode that is triggered by using drugs. During a psychotic episode, the person loses touch with reality and may act differently than their usual self. This can be a frightening experience for the people around them. You learn to recognize the signs. And it says here, what does drug-induced psychosis feel like? When someone is experiencing a drug-induced psychosis, they can find it difficult working and what is real and what is not. This is usually caused by 3 symptoms: hallucinations, delusions, impaired thinking, or impaired cognition. Hallucinations, sensing things that aren't there. Delusions, false beliefs that are not based in reality. Impaired cognition or thinking, this can impact speech, memory, emotions, behavior, and decision making. And the person might have trouble concentrating, thinking clearly, or expressing themselves. The symptoms can begin suddenly or develop more gradually. They can last for several hours or days and then start to fade away as the drug wears off and leaves the body. Yes, there is treatment. Treatment may include stopping use of drug that triggered the psychotic episode, taking medications to help with symptoms like antipsychotic or benzodiazepines, counseling to help address underlying issues like trauma or mental health problems, support for alcohol or drug dependence like rehabilitation services. What drugs can cause psychosis? Cannabis, psychedelic such as LSD and magic mushrooms, amphetamines including crystal meth and cocaine, MDMA, alcohol,